Hi, welcome to my channel. My name is Nasa Kapo, commonly called Bola for short, and I'm here to carry along my journey as a student nurse. And this whole video is documenting my experience as a student nurse during my neuropsychiatric posting, which is just for a month. So I'll be having 1 week posting in Ilorin, Kwara State at the University of Ilorin Teaching Hospital, and I'll be having the other 3 weeks at the Neuropsychiatric Hospital at Aro in Abeokuta, and that's Ogun State. And today is my first day at the University of Ilorin Teaching Hospital psychiatric ward, and it was a wonderful experience. Excuse me. From what from my experience today, I learned quite a few things. Let me not say a lot of things, but a few things, because mental health is really wide. Because of the sensitivity of this posting, I wouldn't be able to document everything, but I can explain it day to day. So today I was on morning duty, and usually we take over from the night shift nurses, and we were oriented about the ward, what departments, which sections, what sections, and there are 3 sections in the psychiatric ward: one for the female, one for the male, and there is one ward. No, there are 3 main sections: a ward for the female, a ward for the male, and a ward for people with substance abuse who are willing and cooperative to seek help. So there is also a clinic section for adolescents and children. I didn't go there today, but they have that facility there. So the nurses were welcoming, they were really nice, and I saw different types of patients and different cases. We had an admission of someone with excuse me, we had an admission, and it was based on substance abuse. So neuropsychiatry or psychiatric ward, basically the people there are not people who are ill medically. Maybe people suffering from just a few maybe had a premorbid diagnosis, maybe they were suffering from diabetes before, or hypertension, but not every one of them. Most of them are okay physically, no defects, nothing. The only thing is the behavior. So we had to monitor patients from absconding, while you're performing whatever activities in the ward. You have to watch the patients for any deviation, maybe from normal to abnormal, or if they are improving. Then one thing that really stood out was the way they document is totally different from other wards, as well as the time for medication. In other words, maybe you could give, it depends on the type of medical diagnosis, or the type of the type of case. But in psychiatry, they give them medication, and the medication is not dependent on if they've eaten or not, because it is just important. Having eaten does not determine if you should take your medication or not in psychiatry. So I really learned quite a lot of new things which did not apply to psychiatric ward, but applied to other wards. So you talk to them, in trying